Welcome to Anatomy with Mo. Today we'll be talking about the skull. So today we'll be talking about the sutures. This is what we call a coronal suture, this is the sagittal suture, and this is the lambdoid suture. These sutures are classified as fibrous joints in what we call synarthrosis. The coronal suture fuses the frontal bone to the two parietal bones. The sagittal suture fuses the two parietal bones, and your lambdoid suture at the back fuses the occipital bone to the two parietal bones. If you was to look inside the calvarium, we'd see these little grooves. These little grooves are what we call the middle meningeal artery, which sits there and has this groove, and that supplies the dura of the brain, and that we will be talking about in another video. Here, what we call the paterion. So we've got your parietal bone, your frontal bone, your temporal bone, and your sphenoid bone. It looks like a H. A good blow to that region will lead to epidural hematoma. Please follow for more. The floor of the cranial cavity has three distinct depressions: the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. In this video, we'll be talking about the anterior cranial fossa. The anterior cranial fossa is made up of three bones: your frontal bone, your ethmoid bone, and your lesser wing of the sphenoid bone. This region is what we call the frontal crest, and the frontal crest acts as an attachment for the falx cerebri, which it's a dual sheet that separates the left hemisphere from the right hemisphere. In the middle here, we've got your ethmoid bone. Sitting in the middle is what we call the crista galli, in Latin, which is known as the coxcomb. Either side of the crista galli is what we call the cribriform plate. Here sits the olfactory bulb. The olfactory bulb goes straight into the cranial cavity and supplies the nasal region for smell. Right at the back here is what we call the lesser wing of the sphenoid bone here, and this region is called the anterior clinoid process, which acts as an attachment for the tentorium cerebelli, which is another dual sheet that separates the cerebellum from the cerebrum itself, and we'll be talking about the dual sheets in another video. The ethmoid bone has an anterior ethmoid foramen, which runs the anterior ethmoidal artery, vein, and nerve, and likewise for the posterior ethmoid foramen here. Clinical context: ethmoid bone is very thin, so a fracture to that region can damage the olfactory bulb and the nerve, which leads to loss of smell in a patient called anosmia. And if there is a fractured bone here, we could tear the dural sheet, then we could have the leak of the CSF into the nasal cavity, which what we call CSF rhinorrhea. Please follow for part 3 for the middle cranial fossa. Today we'll be talking about the middle cranial fossa. The middle cranial fossa accommodates the temporal lobes that sit here, and in the middle we've got your pituitary gland that sits there. So the middle cranial fossa is made up of your temporal bones, and is made up of your sphenoid bone as well. This region in the middle, we've got something called the sella tussica, in which what we call this region is specifically called the hypophyseal fossa, which the pituitary gland sits. This region at the back is called the dorsum celli, and lateral to it we've got something called the posterior clinoid process, which acts as an attachment for your tentorium cerebelli. So the middle cranial fossa has a lot of foramens here, and it's got your optic canal. So this region is your optic canal, which the optic nerve goes through. Adjacent to it, we've got your superior orbital fissure, just there. And structures that pass through the superior orbital fissure are your oculomotor nerve, your trochlear nerve, your ophthalmic branch of the trigeminal nerve, and your abducens nerve. This foramen here, which is known as the foramen rotundum, however, in this model, there's no perforation here, so I'm just showing it here with my clip here, that this is foramen rotundum. What goes through the foramen rotundum is your maxillary branch of your trigeminal nerve. This is what we call the foramen ovale. What runs through the foramen ovale is your mandibular branch of your trigeminal nerve. Posterior to that, we've got your foramen spinosum. running through the foramen spinosum is your middle meningeal artery. This structure here is called the foramen lacerum because it's lacerated here, and in humans, in adults, this region is literally closed with a cartilaginous plug. Clinical relevance. As stated previously, that the pituitary gland sits in the sella tussica, so if a patient has a pituitary adenoma, then the surgeon will take a endoscopic transsaphenoidal approach through the nasal cavity and approach the pituitary gland and take as much tumour out as possible. Follow for more Anatomy with Mo. Today we'll be talking about the posterior cranial fossa. The posterior cranial fossa accommodates the cerebellum and accommodates the brainstem. The brainstem consists of your midbrain, pons and the medulla oblongata, and then you get this region here, your foramen magnum, in which the spinal cord passes through. This region in the middle is called the internal occipital crest, which acts as an attachment site for your falx cerebelli. This is called the internal occipital protuberance. These grooves here, this is where we get your transverse venous sinuses sits. And the posterior cranial fossa is made up of your occipital bones and your temporal bones here. You've got canals and foramens within the posterior cranial fossa. This region here, this is called the hypoglossal canal, in which we passes through is your hypoglossal nerve. This is the petrous part of your temporal bone, and here there's no perforation here. There are a few structures that pass through the internal acoustic meatus, which is your facial nerve and your vestibulocochlear nerve. This foramen here is called the jugular foramen, and what passes through the jugular foramen is your glossopharyngeal nerve, your vagus nerve, and your accessory nerve. Clinical relevance. Cerebellum tonsil herniation can pass through the foramen magnum and can compress on your brainstem structures, which control your cardiorespiratory centers and eventually lead to death if not treated.